Mammography is the best screening tool we have now, but for some women, especially women that are higher risk for breast cancer, MRI has become a big player in those women. It's not for every woman. It's a very different kind of test. It takes longer than a mammogram and it requires IV contrast. So it's not for the general population, but for the higher risk women, breast MRI has been a good supplemental tool in screening for breast cancer. A breast MRI is an MRI like they would perform on a brain or a spine, but we have a special coil for the breast. And again, the study takes longer and it requires IV contrast, but it gets excellent images of the breast. And it takes, at least 30 minutes to an hour to get all the images that are needed. An ultrasound is a very easy, non-invasive test. The patient lays on her back on the table and the technologist uses a probe to scan the area, maybe just the one area of concern, or they may survey both breasts depending on what the doctor's ordered. But it's a relatively short test and it's very good second-line test that's non-invasive, not painful at all. A breast biopsy is used when we found a lesion that needs further evaluation, such as calcifications in the breast or a mass. It may be done under ultrasound guidance, or it may be done using the mammogram to guide us, and that's called a stereotactic core biopsy. And the patient's awake for those procedures, but the breast is numbed up with some numbing medicine. And once they're numbed up, they really don't feel anything, and we just take a needle to take several small samples from the area, and it only takes a few minutes, and the patient goes home right after that. The patient really tolerates the procedure well, and results come back within the next day or two.